Hello everyone. So today we begins with the body fluid compartments. Body water. Total body water is 42 liter, which is the 60 percentage of the body weight, and it is divided into intracellular fluid, which is around 28 liter and 40 percentage of body weight, and extracellular fluid of 14 liter or the 20 percentage of the body weight. In the 14 liter of the extracellular fluid, we include the 3 liter of plasma, which is 1/4 of the extracellular fluid, and 11 liter or the 3/4 of the extracellular fluid, which is the interstitial fluid. The transcellular fluid is around 1 to 2 liter, and it covers CSF, which is the cerebrospinal fluid, aqueous and vitreous humor, pleural and pericardial fluids. So this is the body water. Total body water is around 42 liters or 60 percentage of the body weight, which is in the intracellular compartment and extracellular compartment, and it is the intracellular fluid and extracellular fluid. Extracellular fluid is mainly present or mainly covers the plasma and interstitial fluid. Distribution of body water. Total body mass. Out of this total body mass in male, 40 percentage are the solids and 60 percentage are the fluids, and out of total body mass in female, 45 percentage are solids and 55 percentage of fluids. Here we are considering 60 percentage fluid, and how we divide this. So out of this 60 percentage fluid, 2/3 is the intracellular fluid or ICF, and 1/3 it is the extracellular fluid, which is the ECF. Inside the extracellular fluid, we cover the 80 percentage of the interstitial fluid and 20 percentage of the plasma. Plasma, which is running inside the blood capillaries, and interstitial fluid is present in between the cells. And these both are considered as extracellular fluid. And intracellular fluid, these are the fluid which are present inside the cell. So this is the distribution of the body water. Now which cations or which anions are more present in the extracellular fluid and in the intracellular fluid? So in the extracellular fluid, higher amount of the sodium and chlorine ions are present, where in the intracellular fluid there is a higher amount of potassium ion is present, as well in the anion section, phosphate and organic anions. So these four are the major cations and anions which are present highly in the extracellular or in the intracellular compartment. Common osmolar substances of the body. So in the extracellular compartment, as I told you, sodium, which is 142 milliosmol per liter, and the second one, it is the chloride ion, which is 108 milliosmol per liter in the extracellular fluid. So both these are in a higher amount in the extracellular fluid. Now we speak about the intracellular fluid. It is potassium ion, which is around 140 milliosmol per liter, and it is the highest ion which is present in the intracellular fluid compartment. But here if we speak about the osmolarity of the extracellular plasma to that of the intracellular fluid is both are almost equal. Fluid homeostasis. And what is homeostasis? It is the maintenance of internal environment of the body or the cell to a constant level. So that is the homeostasis, and there is a continuous exchange of fluid between plasma, interstitial fluid and intracellular fluid. These both are the extracellular fluid, and this is the intracellular fluid. The plasma and ISF having the comparable composition due to high permeability of the endothelium, where in the intracellular fluid there is a selectively permeable cell membrane is there. So specific composition, selective permeability of membrane, active transport mechanism is working over the selectively permeable cell membrane. So the composition of the ICF is much different than that of the plasma and ISF, or simply interstitial fluid. So here it is the plasma which is running inside the blood capillaries, here it is the interstitial fluid and this is the cell. So inside the cell there is a intracellular fluid. All right. Body fluids, now which are the functions of body fluids? It facilitates the transport, for example nutrient transport, hormones, proteins and others. Aid in removal of cellular metabolic waste, so it is helps in the removal of the metabolic waste products from the one part of the body to another part, or to the removal system of the our body, for example to the towards the kidney. Provide medium for cellular metabolism, regulate body temperature, provide lubrication of musculoskeletal joints, component in all body cavities, and it is include the parietal cavities, pleural cavities, etc. Water is the principal body fluid and essential for life. Now body fluid gain and loss. GIT is not only the fluid loss system but it is also the fluid gain system. Kidney, it is the fluid loss or fluid preservation system. Lungs, in both direction from the lungs there is a either fluid gain or fluid loss, and from the skin absolute loss of the body fluid. So this is the intracellular fluid compartment where there is a presence of intracellular fluid around 28 liters, interstitial fluid which is around 11 liters, and a plasma which is around 3 liters. So whatever the fluid gain or loss occurs via the plasma, so there is a no much difference occurring in the intracellular fluid or the interstitial fluid at a normal level. But if in some type of disease condition there must be some defect in the body fluid gain or loss system. Body fluids, factors that dictate body water requirements. First, amount needed to give the proper osmotic concentration, and second one, amount needed to replace water lost by excretion and others. So these are the factors which dictate body water requirements. Which requirements of the body towards the water or for the water, which is amount needed to give the proper osmotic concentration. If there is a disturbances in the osmotic concentration or maintenance of osmotic concentration, there will be either increase or decrease in the demand of the water. And it is also the excretion, water lost by excretion or water lost by evaporation from the skin, it determines or dictates the body water requirements. Normal route of water gain and loss. Fluid intake 1100 ml per day. Food, from the food the intake of the fluid is around 1000 ml per day. Metabolic water which is around 200 ml per day, and it is produced during the metabolic processes inside our body. So total intake of the body water is 2300 ml. Now if we speak about the output, insensible loss is around 700 ml per day. From the sweat around 100 ml per day. Feces, in the feces there will be the 100 ml per day, and in the urine 1400 ml per day. If we total these all this output, then total will be 2300 ml output. Fluid shifts in organs and system. Factors that capable of causing large fluid shifts in vivo. Water ingestion, that is also the one of the important factor which causing or which causes the large fluid which is shipped into different compartment. Dehydration, intravenous infusion of various solutions, loss of abnormal amount of fluid from GI tract in conditions of diarrhea, excessive sweating if there is a atmospheric or environmental high temperature is present, and from the kidneys due to kidney damage or whatever thing is there. So these are the factors that capable of causing large fluid shift in the vivo. Fluid volume disturbances, fluid volume deficit, this condition is known as hypovolemia, and important cause is it is the dehydration condition, excessive loss of body water from the body. and occurs more rapidly when coupled with decreased fluid intake. And whenever the condition of dehydration is present, and if it coupled with the decrease in the body water intake, then the condition will be more severe. So how will you find out whether the dehydration is present in someone or not? Skin with decreased turgor remains elevated after being pulled up and released. So if you find this type of skin fold after it is being pulled and reload or released, then there will be the presence of dehydration or the hypovolemic condition. Normally what will happen, just try to do it, try to elevate the fold of your skin and just release. Normally what will happen, in a fraction of a second there is a the skin will become normal. But if there is a condition of hypovolemia, then there is a fold is present or the skin fold is present even after it is being pulled up and released. All right. Fluid volume deficit causes severe diarrhea, vomiting or sweating, excessive urinary output, and it is due to the diuretics or disease. Clinical manifestations: acute weight loss, dryness of mouth, increased thirst, decreased urinary output, leg cramps, fall in cardiac output or blood pressure or both. Many vital systems are affected if there is a fluid volume is deficit, coma and death. If there is a much severe type of fluid volume deficit, then it will also leads to coma and death. Fluid volume deficit mild. When we say there is a mild fluid volume is deficit, loss is about 2 to 5 percentage of the body weight. When the loss is about 5 to 10 percentage of body weight, so there will be the moderate fluid volume deficit. When the loss is about 10 percentage or more of the body weight, then we can consider this as a severe fluid volume deficit. What will be the treatment? The treatment will be the fluid supplements, oral or intravenous, and stop fluid loss either due to some type of cure treatment will be given to the diarrhea patient or the vomiting patient. Fluid volume disturbances, fluid volume excess, it is known as hypervolemia, and in the conditions of hypervolemia there is a presence of edema. What do you mean by edema? It is the accumulation of excess fluid in interstitial spaces. Edema may be pitting edema or non-pitting edema. So when you press the swelled part of the body and once you released your finger from the body, then if you find this the area is still just looks like a depressed, then it is the pitting edema. And if the area will become normal or it will become flat, then it is the non-pitting edema. There will be the generalized edema or the local edema. Generalized whole body edema, and local means either one limb or both the limb, upper limb or both the lower limbs are edematous. Now the imbalance of sodium. Normal range of sodium is 135 to 145 milli equilibrium per liter. Hyponatremia, when the sodium level is less than 135 milli equilibrium per liter. It may be caused by vomiting, diarrhea, sweating and diuretics. Hypernatremia, when the sodium level is greater than 145 milli equilibrium per liter, the condition is known as hypernatremia, and it can be caused by a gain of sodium in excess of water or by loss of water in excess of sodium. So these both the condition are known as imbalance of sodium. Normal range is around 135 to 145 milli equilibrium per liter. If the sodium level is below the normal, the condition is known as hyponatremia, and if the sodium level is above the normal, the condition is known as hypernatremia. Imbalance of potassium. Normal range is 3.5 to 5.5 milli equilibrium per liter, and when the serum potassium level is below 3.5 milli equilibrium per liter, the condition is known as hypokalemia. And which are the causes of hypokalemia? Diarrhea, diuretics and poor potassium intake. So these are the causes of hypokalemia. Now hyperkalemia, when the serum potassium is greater than 5.5 milliequilibrium per liter, the condition is known as hyperkalemia. And moderate dangerous than hypokalemia because cardiac arrest is common with high serum potassium level. So normal range of the potassium is 3.5 to 5.5 milliequilibrium per liter. And if there is a decrease the serum potassium level below 3.5 milliequilibrium per liter, the condition is known as hypokalemia. And when the serum potassium level is more than 5.5 milliequilibrium per liter, then the condition is known as hyperkalemia. Measurement of body fluid compartments, which is the method for the measurement of body fluid compartment. It is the indicator dilution method. And measurement of total body water, how we are going to measure the total body water inside our body. So these are the markers of the total body water. Radioactive water, which includes the deuterium oxide or D2O and tritium oxide. These are the markers or the radioactive water markers. Antipyrine, and it can be calculated by concentration in the plasma. So these are the total body water measurement methods. Measurement of different compartments, measurement of ECF, extracellular fluid compartment, and via the radioactive substances which cannot enter the cell. So we can measure the extracellular fluid compartment, which includes the plasma and interstitial fluid compartment. Sodium bromide 92 Br minus, chloride 36 Cl minus, 38 Cl minus we are using, and these are the radioactive substances. Thiosulfates, inulin, which is the most accurate method for the measurement of extracellular fluid compartment volume. Mannitol and sucrose we are going to use for the measurement of ECF. Alright, so this is the measurement of different compartments, and these all are the methods we are using for the measurement of extracellular fluid compartment. Now measurement of plasma, markers which bind strongly with plasma protein but not enter ISF, means interstitial fluid. Markers which bind strongly with the plasma proteins, but it is not going to enter or cross the blood capillaries and enter into the interstitial fluid compartment. So these are the radioactive iodine I131, Evans blue dye T1824. So these are the markers which measures the plasma. From this total body water measurement, measurement of ECF, measurement of plasma, we are going to measure the intracellular fluid volumes, interstitial fluid volumes via just simple calculations. All right, okay. So this is all about the body fluid compartments, and body fluid distributed mainly in two compartments: intracellular fluid compartment and extracellular fluid compartment. Extracellular fluid compartments includes the plasma and interstitial fluid. Plasma, it is the fluid which is running inside the blood vessels or blood capillaries, and interstitial fluid, this is the fluid which is present in between the cells. So this plasma and interstitial fluid collectively forms the extracellular fluid compartment, whereas the fluid which is actually present inside the cell, it forms the intracellular fluid compartment. If you like this presentation of body fluid compartment, then please try to share with your groups.